The federal opposition is calling for coronavirus testing to be increased. Shadow Health Minister Chris Bowen spoke a short time ago.
Obviously, as this crisis unfolds, we continue our approach of supporting every step that the government has put in place, but constructively calling for more. Christina and I will be doing that this morning in relation to a couple of matters. Firstly, in relation to testing. We need to test, test, test. People across the country are working their guts out to test more people, but we need to do better as a country. I understand the constraints, I understand the limitations on testing, but we need to do more. And today we say it must be the formal objective of government policy to have people tested if they are in contact with people who've suffered COVID-19 or have symptoms, not and have symptoms. People across the country are exhibiting symptoms, obviously very worryingly, going for tests and being denied tests because they don't meet the criteria. The Deputy Chief Medical Officer has made it clear if there were more tests, they might consider different criteria. We know from South Korea that testing is one of the key elements in beating this virus. In South Korea, 5,500 people per million are being tested. In Australia, 3,300. That's a big difference. We need to do more. Also, people are waiting too long for test results. I've heard reports of 8 days, sometimes 6 days. We need to do more. Interestingly, other pathology tests aren't occurring at the same rate. People are getting less testing done. There's been notifications to the stock exchange by pathology companies of profit warnings. We have spare capacity in the pathology sector. We need to ensure that every single pathologist in the country is deployed, every single pathology practice in the country is deployed to get these tests turned around more quickly. Again, we don't underestimate the complexity, but much more needs to be done. Now, another issue is self-isolation and ensuring the support for people in self-isolation. The Prime Minister correctly said yesterday, self-isolation means self-isolation and people should comply with the law. But we also need to ensure we're supporting those people so that they aren't tempted to break the law. And Christina and I have been talking about that, and Christina will have further comments to make about that particular suggestion and also other breaking developments.
Thank you, Chris. There are right now in Australia thousands of people self-isolating. Some of them are self-isolating because they have been diagnosed with COVID-19, some because they have been in close contact with someone with COVID-19, and some are self-isolating because they've been directed to by the government having returned home from overseas. Labor supports that direction from government and thanks those Australians who are taking steps to self-isolate during this health crisis. We also know that many people are self-isolating because they are elderly and they run a high risk if they contract COVID-19. Now, when it comes to self-isolation, one of the things we need to ensure is that people have access to a secure supply of food. And in the last week, we have seen major retailers take a decision to discontinue home delivery of groceries. Now, our food retailers in Australia have been working incredibly hard. They have taken extraordinary steps to meet extraordinary demand, and we acknowledge the work that they have been doing. And no one here is blaming the food retailers for taking what is a necessary decision in order to ensure that we have food stocks on the shelves. But what is happening now is that people who are in self-isolation, who cannot access home delivery groceries, are being directed to food bank. And that is a completely unacceptable way to address this gap.